Ready for medical career growth? Yes, you are in the right place. Hello, this is Dr. Neema Bish, BDS by degree and a pharma professional. As a founder of Career in Pharma, our mission is to guide medical professionals towards remarkable success in the pharma industry. With a track record of over 700 plus students trained and placed into various premier pharma companies, we are here to elevate your journey. Hello everyone, once again I welcome you all to Career in Pharma. So in today's video we are going to discuss about the important questions for drug safety physician or medical reviewer. Now inside this, apart from telling you important questions, I will also let you know what is the eligibility criteria, the salary, how it's decided at a fresher level for this role. And I bet you that if you go through this video, definitely if you have any interview lined up for drug safety physician or medical reviewer, definitely you will be very easily able to clear the interview. Okay, so let's begin with this. Now, drug safety physician is also known as medical reviewer. So medical reviewer, drug safety physician are the same profile. Depending on the company, their name may varies. For example, inside TCS, we call it as medical reviewer, but in other companies, it is called as drug safety physician. Okay, so don't get confused if you see this thing anywhere. Other very important point I want to mention is in few profile inside medical insurance claim company also, they call few profile as a medical reviewer. So that medical reviewer profile for any medical insurance claim company is totally different from the medical reviewer profile inside pharmaceutical industry. Now eligibility. 99%, I would say 98% times MBBS, MD or MS or just MBBS with clinical experience, without clinical experience, means basic education qualification for drug safety physician medical reviewer is MBBS. That is the most basic qualification criteria. Apart from that, few companies like 1 to 2% companies, you may find that they may hire even physiotherapists, Ayurveda graduates, homeopathy graduates, and even dentists as a medical reviewer. Now, what is the difference between these two? Now, if any company is hiring alternate medicine graduates as medical reviewer, then in that case, the compensation, the salary that any MBBS gets will not be same for you. Now, for example, if any MBBS student guy is starting with a CTC of let's say 12 lakh or 13 lakh, that CTC depends on that person's current CTC. Then in that case, if you are an alternate medicine graduates and you get a job as a medical reviewer, your CTC will not be like 12 lakh, 14 lakh. Maybe you will just get, 5 lakh, 6 lakh or 7 lakh, depend on your final, negotiation with the company and whatever the company's budget is. So this is the difference. Okay, but it's not very easy to find a job as a medical reviewer for alternate medicine graduate because few companies are there. And usually these companies are not very big companies. They are like small CROs or small pharma companies because they have less budget and that's why they hire alternate medicine graduates also as a medical reviewer. Now this was about salary. Other than this, role wise doesn't matter if you are a MBBS or an alternate medicine graduate, you have to play the same role. It's just the difference in the salary. Okay. Now third point is regarding license. So regarding this medical reviewer position or drug safety physician, irrespective of if you are a MBBS or an alternate medicine graduate, your registration is must. Means the company who looks for licensed doctors, they will ask for your registration, DCI, MCI or whatever body is there to provide you the license or the registration to practice as a clinician. But yeah, there are few companies who can hire you as a medical reviewer or a drug safety physician without license and registration also. But again, these companies are very less, and why they hire you without registration? Again, you have to compensate, you have to compromise in terms of salary, because the same salary which any licensed practitioner is getting, you will not get the same. That is the reason. But yes, without registration also you can get as a medical reviewer or a drug safety physician. Now to start with the interview questions, before that, there are two very important questions irrespective of whatever profile you are going to give interview. If you are from a clinical background and you want to look for a job inside non-clinical background like pharma industry or maybe medical insurance or maybe any other non-clinical stream, one very important question to you will be why you want to come to non-clinical sector, or why you want to leave or quit your clinical practice. That is very important questions interviewer is going to ask for sure. Before they ask you, before they jump into the technical question, core pharmacovigilance question, they will ask you this question for sure. So please prepare it. Don't try to manipulate or fabricate. Whatever authentic answer you have, please tell that. But don't give over explanation. Just be very crisp and clear and confident. Very important. Other very important journal question is, please prepare your brief introduction also, where you should be able to introduce yourself in less than a minute, where you can tell your name, your qualification, from where you completed, in which year you completed, after that what you did and what you are doing currently. That is your brief introduction. No personal details, no family history you have to give. So these are common general question. Your brief introduction and why you want to switch to non-clinical career, being from a clinical background. Now, regarding technical question, because this is a pharmacovigilance profile, this is not a clinical trial profile, so it is a pharmacovigilance profile. So you should be knowing what do you understand by pharmacovigilance, what is adverse event, what is adverse drug reaction, difference between these two, what are different criteria to classify any adverse event as a serious adverse event, SAE. Then causality, as a medical reviewer or drug safety physician, causality is very important. So you should be knowing what is causality assessment, what is causality, different scale to identify, different scale to assess the causality assessment. And apart from that, you should be knowing the listedness, what is listedness, what is unlistedness, what is expectedness, what is unexpectedness. And MEDRA, very important, being a medical reviewer. What is MEDRA? What all things you code with the help of MEDRA? Hierarchy of MEDRA, current version of MEDRA. And signal. What is signal? How you detect signal? This is also very important for pharmacovigilance question. Now, apart from pharmacovigilance question, if you are going to give interview for a medical reviewer, definitely clinical questions they will ask you for sure, 100% sure. Means clinical questions depends on what was your background. Means let's say if you are orthopedician or maybe you are from some dermatology background, then accordingly clinical questions will be asked to you. So it is a thumb rule. Whenever you are in confusion what to study from clinical and pharmacology, then the thumb rule is whatever background you are holding from your clinical, please prepare that very well. For example, if you are into ortho, then definitely the disease of ortho, the medicines of ortho, those pharmacology of those medicines, that you should be knowing. So depending on your clinical background, let's say you are a dentist, you should be knowing antimicrobials, the antibiotics which you prescribe, opioids, painkillers which you prescribe, you should be very well versed with that. Other than this, regarding clinical and pharmacology, how you can prepare is, please always Google the company where you are going to give interview. Google what the company do, in which all therapeutic area the company is, because when you will be sure in which therapeutic area the company is, accordingly you can prepare medicine and pharmacology. So let's say if the company is into chemotherapy, then please prepare chemotherapeutic agent, pathophysiology of cancer, benign tumor, malignant tumor, different scale to classify tumor, TNM classification, all those kind of things. So depending on what all therapeutic area the company is, accordingly you have to prepare medicine and pharmacology. Other than this, all the common disease, regarding that also you have to prepare. Now common disease means, I can say lifestyle diseases which are very common now, diabetes, hypertension. So these are like common one you have to go through, okay, for clinical and pharmacology. Yes. So this was about important interview questions which will be from both technical, core PV and from clinical and pharmacology. Now other than this, many people ask that how to negotiate for salary, okay, which is very important actually. Now regarding salary negotiation, what you can do, if you are an experienced clinician, let's say you are an MBBS or MD and you already working somewhere, maybe you have 5 years of experience, so whatever current CTC you are drawing, let's say you are already getting 12 lakh of CTC in your current organization. So to that you can always add 10 to 20%, and that you should be expecting in your current, in your future organization. So accordingly you can negotiate also, because you can say that already I am getting 12 lakh and definitely to that you can add 10 to 20%, and that should be your salary, and for that you can negotiate. Okay, never settle for less. Okay, definitely whatever you are drawing currently, you should be getting more than that. Yes, that's why you are looking for change, right? So that's all about drug safety physician important question, salary, how you can negotiate, and interview questions and eligibility criteria and everything I have discussed. Okay, so I hope this interview going to help you for interview preparation for drug safety physician. Yes, and remember one thing, whenever you are answering anything, you should be very confident. You should be having clear energy. Means you should not be in doubt whether it's for you or not. So you should be very clear, confident with clear energy, and that will help you in clearing interview. Other very important point is, don't think that you should be able to answer all the questions. It is very common that you will not be able to answer all the questions. Means if the interviewer is asking you 10 questions, among that definitely 2-3 questions will be there which you will not able to answer. So that is completely fine, and that happens with everyone. Okay, so no one can answer all the questions. So just be confident, don't get nervous, and be flexible. And yes, that's all about interview preparation for drug safety physician. And I hope this video is going to help you to crack the interview for medical reviewer. With this, I'm going to conclude this video, and please don't forget to subscribe to our channel if you think this content is really helpful to you. And also don't forget to share with your friends, your colleagues who are looking for interview questions for drug safety physician. Yes, and with this I'm going to conclude. Once again guys, please don't forget to subscribe it, and we'll be coming soon with some fresh next video. Till the time I come again, till that time, please stay safe, healthy, aware, updated, and keep exploring new things.